All right, looks like we're live. Let's see who all we have. Don't know that we can see that. Well, I want to thank you all for joining the Society of American Military Engineers Architectural Practice CIO webinar today. I'm Colby German, a Vice President and Senior Medical Planner with HKS with over 15 years of healthcare planning experience, and I'm pleased to be your moderator for today's session. I want to first thank our speakers, Megan and Laura, for their time and sharing some of their great insights around the criticality and the appropriality of storage within our patient care environments. A few housekeeping things. We all kind of know how these things work. I won't read these things word for word for you all, but you know kind of how this might go forward and work out. And first here, though, we have a poll, just so we have an idea of who all is on the call today, so we can maybe better tailor our message to you today. Give that a minute to go through, give you all a chance to submit. See them coming in here. Okay. Looks like we're around 29% small business today, along following right behind that active duty military members. Thank you for your service. All right, Laura and Megan, I will turn it over to you.
Awesome. Thank you so much, Colby. I appreciate it. And very grateful for the opportunity to present to all of you today. Our Designing Healthcare presentations really going to walk you through some of these current trends and challenges in the healthcare environment and really show how thoughtful storage design can help address these challenges as well. Just from a short introduction standpoint here, my name is Megan Skinkis. I am the Channel Marketing Specialist here at Space Saver, coming to you from our headquarter location and our manufacturing location in Fort Atkinson, Wisconsin. Also on the call, helping me today is Laura Walton. She is the Director of Marketing here at Space Saver. She'll be helping me monitor that chat. So if you have any questions, feel free to put those into the chat as we move along. Also want to say that Space Saver does offer a nationwide network of distribution partners who can assist you with all of your projects that you may be working on in the healthcare market and beyond, and can certainly get you connected to the correct local resource at any time. And this is both AIA and IDCEC accredited. So if you are looking for those credits, we'll certainly get this attendance submitted for you guys, and we'll get certificates out your way as well. So be on the lookout for those. And here's a quick peek at our learning objectives, what we're going to walk through today. First, we want to identify the main challenges within the healthcare arena and then incorporate that into the designs that are offered to this community. A lot of today's conversation, it is going to be about storage solutions and how they directly contribute to improving patient care, controlling costs, and saving space. Those are all three themes that you will hear repeated throughout. And here's just a look at our agenda. Going to take a pretty deep dive into those market insights and the challenges that these healthcare facilities are currently facing. And then we're going to layer in how storage solutions can support both modern and ready healthcare facilities. So hope to show you here throughout the presentation. I'm going to paint the picture on why saving space is so important in these facilities. So I'm going to first start by addressing storage at a very high level here. Now, space in healthcare centers, it is expensive. It's expensive to design, expensive to build, and also expensive to occupy as well. Now, every cubic foot that's used for storage is space that could be used for that patient care. And let's face it, those patient care areas are the spaces that generate that revenue. Now, exam rooms generate an average of about $238,000 per year in revenue. And we've also learned from partners specializing in healthcare that that figure can actually be as high as $20,000 per day. So, with that in mind, there is a misconception that because storage space doesn't visibly impact that patient care and directly contribute to revenue, that storage is wasted space. But I'm sure, as you know, if you work in this healthcare environment, nothing could be further from the truth of that statement that I just said. These hospitals and healthcare facilities, they exist to help people heal. Now, helping people heal, it does require a lot of stuff. When I'm talking about stuff here, that's things like syringes, medication, surgical instruments, and much, much more. That list could go on and on. And that stuff, it needs to be stored, whether that space is allocated for it or not. And staff and facilities that weren't designed with adequate storage, they really do suffer the consequences. When I'm talking about consequences, things like time wasted walking to distant storage areas, time wasted moving items looking for supplies, and just those overall operational inefficiencies, as well as some of those inventory management issues as well. And this impacts morale and the overall patient experience. And just to reiterate, all the space that's devoted to storage is space that then can't be used for that patient care. That's why it's so important to store items compactly while still providing that full, convenient access that is needed to these supplies and equipment. So today, I'm going to show you how this thoughtfully designed storage helps control costs, improves patient care, and staff satisfaction, and also makes the best use of space in these healthcare facilities. And first, going to start here just with some market insights to give some background knowledge as well. Now, healthcare facilities, they are constantly changing and constantly evolving to reflect new standards of care and also some new market realities. Now, speaking quite broadly here, right now there are more renovations than completely new construction projects in this market. Now, having said that, according to a 2021 Dodge Construction Outlook, $99 billion in healthcare construction spending is expected in the coming year. And healthcare designers are looking at solutions which will enhance both productivity and also that patient satisfaction. Research showing expansion and consolidation within the industry as those large players are acquiring some of those more small hospitals, clinics, and other facilities. And this type of activity will undoubtedly change those environments as well. Also, we've seen a demand for services increase. The US population is growing, and it is growing older. By 2025, the population is projected to be 12% higher than it was in 2000. And by 2045, the proportion of people over 65 is estimated to peak at approximately 20%. So this equates to about 78 million baby boomers, and they are dramatically changing how hospitals are built and also how these hospitals are operated. And in a recent American Hospital Association survey, over half of hospital CEOs expressed the need to improve facilities and that overall patient flow. We've also seen visits to the emergency department increase steadily, and health systems are under mounting pressure to deliver efficient and also cost-effective care as a result of increased insurance coverage under the Affordable Care Act. Now, additionally, the American Rescue Plan significantly expands access to healthcare for many Americans. This potentially creates an influx of patients on what is already a tax system. So learning how facilities will react to this, it's going to be an ongoing topic and conversation, really thinking about how space optimization and that storage management are affected with these increases. We also have to think about some of those physical changes that also reflect and support advances in technology. Now, space that was used about 20 years ago to store X-ray films and prints, that is now being repurposed as X-rays are digital. So ever-changing technology, it does require, again, some of that constant attention, not only in point-of-care technologies, but also thinking things here like wireless technologies for staff, electronic medical records, and barcoding for that medication dispensing. And also have to think about those patient rooms and how much they have changed as the healing center, as well as some of the amenities that are now offered, like controls for HVAC, lighting, and also window shades. All of these things truly affect the healthcare environment as we know it. And moving from more that physical to the financial, we've all heard about sky high healthcare costs, but less well known is the fact that many healthcare institutions are facing financial hardships. Now, even before the pandemic, healthcare operating margins were very low. 2 to 3% is considered an industry average, but many hospitals do lose money when these margins are so thin. So strategies to boost revenue may not be as effective as a strategy to reduce that cost. So what contributes to these financial challenges? Now, operational costs, they have been rising for years, including the growing cost of infrastructure and increased labor costs. Now, additionally, that market consolidation that I mentioned already certainly has costs associated with it. And also that shifting revenue mix from commercial to government payers means some even slimmer margins. However, uncompensated care is decreasing due to more individuals with coverage under the Affordable Care Act. And COVID-19 has compounded the problems with healthcare system finances. Now, this chart is displaying year-over-year changes in Q1 revenue between 2019 and 2020. Now, this may seem a bit dated here, but these trends and the effect of COVID-19 are still impacting healthcare facilities and finances in this way. Now, 1/3 of hospitals were operating in the red prior to the pandemic, and experts were projecting a minimum of $120 billion in financial losses from July through December of 2020. Now, hospitals in early 2021, they did continue to see those lower operating margins, volumes, and revenues, while expenses for things like labor, drugs, and PPE equipment continued to be higher than normal. Now, one reason for those lower revenues is that many hospitals' revenue center is surgeries, particularly speaking here about those elective surgeries. Of course, the pandemic had led to a surgical backlog for those elective procedures because of lack of hospital capacity, those workforce shortages, and also those new safety protocols that were put into place. Healthcare systems are having to optimize their clinical operations to address the discrepancies in this supply and demand. Now, outpatient activity did pick up in spring of 2021 following widespread vaccine availability, but revenues increased, but those costs still remained high. Now, this is something that is continuing into 2022. Expenses are still high from things such as labor and specialty supplies. Now, labor shortages, they have not eased, which is keeping costs high. And in addition, patients with chronic conditions who may have delayed care are now coming in sicker, requiring more infusions, expensive specialty pharmaceuticals, and pricey supplies. And these trends are still having an impact again on these healthcare margins. And this is something we will continue to monitor throughout 2022 and beyond. So now that we have those market insights, I want to layer in some more specific challenges within these healthcare environments. And from a facility standpoint, healthcare organizations are facing three major challenges, the three themes of this presentation, all about controlling costs, providing that patient-centered care, and helping conquer those space issues. So going to dive into each of these to better understand their drivers and address how thoughtful storage design can help. Now, the first major challenge, all about controlling those costs. As I mentioned, COVID certainly has contributed to those rising costs. Now, while healthcare organizations have gotten past those initial PPE shortages, they now have had to increase their inventory levels for more of a preparedness standpoint. Employment, also a factor right now. Hospitals' largest expense, it is labor. In the current landscape, there are challenges with having enough staff on hand. And on top of that, healthcare human resource departments will continue to face a major skills gap, especially when it comes to filling nursing positions, a problem that will worsen as hundreds of thousands of aging baby boomer nurses are set to retire. Also, want to think about things like HVAC system improvements and sterilization services. There's been so much conversation in the last 2 years about airflow and circulation as a method of that infection control. So, how many institutions need to update their HVAC systems to comply with some of these new standards? And what are the additional items that need to be factored into this healthcare environment? Now, these are questions that designers certainly need to address when planning for these projects. And COVID has contributed to both rising costs and decreased revenue. So, really, everything that I talk about from here on out, it must be viewed through this lens. How can we help our clients in the healthcare sector best serve their patients while controlling their costs? Now, the second major challenge within healthcare environment is patient-centered care, which is driven primarily by healthcare goals focused on improving patient outcomes. Now, the healthcare facility, it's the healing center for the patient. These are the spaces that are bright, they're welcoming, and as a result, facility design trends are prioritizing flexible design and adaptable spaces that offer some of the future proofing that we hear also about in other markets. And they're also focused on sustainability, not only to be a healthy building, but also to contribute to those cost savings as well. And an important aspect of patient-centered care, it revolves around the personnel who deliver that care. Now, as healthcare facilities are currently competing to recruit and retain the best talent, job satisfaction is a huge concern here. Doctors and nurses, they typically go into the medical field to spend time with patients, not to walk long distances to supply storage or to be looking for those supplies. Yet one study found that 1/3 of nurses spend an average of 1 hour per shift looking for equipment and supplies. Now, as you can imagine, this is certainly frustrating, and it can lead to dissatisfaction with the functionality of their workspace, not to mention some of those wasted labor costs as well. And even before the COVID crisis, infection control, a huge, major concern for healthcare facilities, and keeping items both sterile and well organized is an ongoing need. Now, improper storage can result in damage or contamination to supplies and equipment, which in turn can lead to some serious consequences of patient infection. Now, each year, the CDC estimates that 2 million people obtain hospital acquired infections, and 96,000 of these people die each year from these infections. So, by storing items properly and at that point of use, facilities can help both patients and providers alike. This convenient, organized storage, It helps to improve patient satisfaction by decreasing wait times, and it contributes to increased job satisfaction by allowing healthcare professionals to spend more time with their patients instead of looking for supplies and the equipment that is needed throughout their day. And COVID has emphasized the need for more flexible spaces to be available. Healthcare facilities, they need the ability to adapt as their needs are constantly changing. So what can their spaces look like if there is a large influx of patients, as there was during the height of the pandemic? Really, to tie back to the last slide in terms of infection control, the pandemic also created the need for more specialty rooms, particularly negative pressure rooms, and it also increased concerns about the health and safety of all building occupants when patients of all types are being treated in the same facility as those highly infectious patients are. And the last major challenge within the healthcare environment, it all revolves around space. Now, as mentioned, there is an incredible number of supplies within a healthcare environment to keep organized to help maintain those optimal workflows that are needed. And then you layer in shortages, those supply chain disruptions during the COVID-19 crisis, which caused many healthcare institutions to conclude that the safest, smartest way to ensure readiness is to acquire and store their own PPE equipment and cleaning supplies. Now, although a very prudent strategy that I just laid out, it does pose a very practical question. Where can these items be stored? They take up a lot of space, and we also need to remember that every inch that's devoted to storage is space that then cannot be used for that patient care. Another space issue currently being experienced is actually a rule change that requires better protection for inpatient pharmacy employees when handling and storing hazardous pharmaceuticals and chemicals like those that are used for chemotherapy and other treatments. Now, one of the requirements is to build new clean rooms, but hospital pharmacies, they often find themselves landlocked and they can't expand that physical footprint. So that means they need to increase their storage capacity in the space that remains after they've built these new clean rooms and other compliant areas. Cold storage, also very vital to a variety of healthcare functions, but it is expensive to build and it is expensive to operate. So finding solutions like high density storage that can dramatically increase storage capacity and reduce operating costs in these spaces is something that is imperative. And further along in this presentation, we go through some real world examples, if you will, in both pharmacy storage and cold storage are something that we do address down the road here. Now, with space as this perpetual concern, this is where design and planning, it really comes into play. Research indicates that healthcare facility design is trending towards the growth of multi-use facilities that offer flexible and personalized patient care. This really ties into that theme of patient-centered care. Design also needs to be both modular and adaptable. These spaces need to allow for future facility growth and also that flexible use. Future proofing, a big part of the conversation in many types of markets, both in healthcare to higher education and beyond. Now, there's also a need for sustainability focused designs that are maintainable to promote overall cost savings and value. The focus here is really on the ability to maintain facilities at the level needed to still contain those costs. And also, designers are looking for more of an open core model that moves major support functions, thinking things like staff lockers and offices, to a central hub area connected to patient wings with medication and medical supplies deployed to those wings. A key design consideration with this model is the location and the contents of these PPE cabinets and the amount of casework in these patient rooms. Having adjacent supply alcoves outside each patient room can reduce overstocking and hoarding of supplies in and around those patient room areas. So to circle back to something that I said at the beginning of the presentation, storage may not be considered glamorous, but it affects nearly every aspect of the healthcare delivery system, from job satisfaction to overall patient care. So now, as promised, I'm going to look at some examples just to help provide a bit more context to some of these challenges and solutions. So in this portion, I'm again going to show some of those real world examples of how proper storage and space utilization supports your efforts to help healthcare clients achieve their various goals. And starting first here with a diagnostic lab project. Now the goal here, this lab wanted to rapidly create a 6-fold increase in capacity for COVID testing. They were using high density mobile systems. One was for materials management and 2 were for testing, storing test kits in these refrigerated rooms. Now, as you can see in the photo, their use of high-density mobile systems helped eliminate that wasted aisle space. The high-density systems in these refrigerated rooms feature aluminum tread flooring on a false floor that is easy to clean and will allow the system to be moved in the future if that is something that is needed down the road for this facility. And now taking a look at a pathology lab. Now they had initially invested in a walk-in refrigerator and a wheeled cart system to store their biological specimen for medical testing. But the cart system was very crowded, very cumbersome, I'm sure, as you can imagine. Now staff needed a safe and efficient solution for storing and retrieving their refrigerated samples, and the system needed to work here reliably in some near freezing temperatures. So what they did, they installed a high density mobile system that was custom designed to fit the space, and it helped increase that storage capacity by at least 130%. The system also improved turnaround time because staff no longer had to move several of those carts to get what they needed, and also the system's tidy appearance and that smooth operation mean that staff can truly focus on their mission rather than struggling with their inconvenient storage that was in place originally. Now, with this new workflow, the lab staff processes around 17,000 samples in a 24-hour period, and the system's convenience, durability, and efficiency have also boosted staff morale and improved that customer service overall. So great value added with that installation of a mobile system here. Now, looking at a project that focuses on inventory control, this particular hospital was paying more than $86,000 a year to lease an electronic supply management service to store and dispense supplies for their cardiology procedures. Now, the lease system included locked cabinets, handheld barcode scanners, software, and support services. And the materials manager realized the hospital could purchase equipment outright and save the hospital money. So what they did, they called in their local storage consultants who worked with the manufacturer's engineering team to create 4 post shelving cabinets that fit in the allotted space. They permitted visibility for those stored supplies, and they used secured locks so those supplies could be secured appropriately. Slope tops, as you can see from the picture there, were also added to promote cleanliness and to prevent staff from placing any items on top of those cabinets. The results, as you can see from the picture there on the slide, is a bank of cabinets that are functional and aesthetically appealing, and that also serve as the basis for a very unique high-tech materials management system after accounting for the labor costs and the capital and equipment investments. The hospital has realized a savings of just over $38,000 per year since these cabinets were installed. Now I want to bring in an element of storage that may not be on the top of your list of considerations when designing or working in these healthcare environments, and that's emergency room evidence storage. Now, the term chain of custody, it refers to the detailed documentation of evidence collection and handling. Maintaining a secure chain of custody, it's of vital importance because a criminal case, it can be disrupted by questions about the integrity of said evidence. So that's why when crime victims do present at emergency rooms or these other healthcare facilities, staff must be ready and also able to collect that evidence, document it, and store it securely, in effect, maintaining the entire chain of custody here. And now looking at a sterile core. Now, in a traditional surgery suite design, operating rooms are grouped around a sterile core that is utilized by the circulating nurses, and supplies are taken into the operating rooms in preparation for surgery. Now, these spaces, they must be clean, they must be organized, and they must be designed efficiently. This hospital pictured here utilizes high density shelving to keep sterile surgical supplies clean and organized in about half the space that would be required by using non-moving or static shelving. Fluid storage, also very important in the healthcare environments for dialysis clinics, hospitals, and other healthcare facilities alike. They must store large quantities of pre-formulated medical solutions for patient treatments, and these liquids must be kept sterile and organized, but the jugs can be very heavy and they can take up a lot of space. So this hospital installed a mobile system to assist with their fluid storage that provides smooth and reliable carriage operation, full configurability, which allows jugs to be stored on those flat, sturdy shelves, and then those smaller packets like you see here on the slide to be stored in a modular bin system. And this installation was actually completed directly atop the floor slab, which is also possible in these installs in the healthcare environment. And staff at this Midwestern Cancer Treatment Center, they had been struggling with poorly planned storage for many, many years. Storage in their original facility, it had not been thoughtfully considered, and that's why when they were asked what their top priority would be in a new addition, they requested one convenient, centralized storage location where they could find everything that they needed. So now, even though the facility is expanded and serving more patients, staff are actually spending less time looking for those supplies because they are all in that one location. And as promised, I wanted to address the pharmacy storage project here. As I had said, hospital pharmacies are undergoing some major renovations to comply with strict new USP 800 regulations that govern how hazardous chemicals are both stored and handled. Now, this hospital had to install clean rooms within the pharmacy's existing footprint, so they needed compact storage to make the most of the space that they had available. Now, high-density systems, they are ideally suited to pharmacies' needs for efficiency, for organization, and also for security. Now, systems can be installed on top of existing floors, and they can optimize space both horizontally and vertically based off of what is available in that space. Now, to help protect some of these fragile glass bottles and vials that will be stored, powered systems have a soft start and a soft stop feature, And this can be combined with shelf dividers, with bins, bin fronts, and anti-tip rail for even more of that shock protection. And powered systems also can be locked to prevent any unauthorized access, adding that additional level of security. And now to the cold storage project that I had mentioned. Now, this hospital, they needed a compact way to store lab samples in their cold storage, and they needed stainless steel mobile systems and chrome shelving to meet sterility requirements. But sterility, really only one piece of the puzzle when looking at this project. The hospital was remodeling to add more space for their lab activities, but they didn't want to sacrifice precious cooler storage for those sterile supplies and samples. So by installing the stainless compact shelving that you see there, along with chrome racks, the cooler space was greatly increased without that need for a costly expansion of those actual coolers themselves. The high density shelving also helps save on energy costs, as that more tightly packed cooler, it helps increase that temperature stability. Also, a dual control system allows aisle access from both ends of the shelves, so employees can quickly find what they need and work more efficiently overall. Stainless steel system, also rust and corrosion resistant to handle the cooler storage conditions. But more importantly here, it also has the added benefit of easy cleaning, which is an absolute must for these healthcare environments. And as I mentioned earlier, many facilities are opting to store bulk supplies of PPE, and they do want to avoid those future problems. So some are storing them on site and need new solutions to allow them to store more supplies in the same amount of space. And then other organizations looking to store supplies in an off-site facility to free up space in their primary location. Now, offsite storage potentially takes advantage of less costly storage space as well as vertical space that may not be available in that main location. Penn Medical actually opened an offsite facility for its clean, sterile services. Now, objectives for this new concept in central sterile services focused on right-sizing operations, improving efficiencies, and also staff safety was important in this project as well. Now, benefits of the offsite facility include freeing up their entire floor space in their new pavilion facility that would have been dedicated to clean, sterile services, and also helping with space constraints in some existing buildings as well. So some of the value add when you go off-site with those supplies. Now I want to talk about a food storage project that was completed at a university's hospital. It was at first very cramped, very crowded with dry goods and non-perishable foods. They were stored on wire shelving with casters. So staff often had to move and roll several of these shelving units out of the way in order to reach the items that they needed. And they were also running out of space in this storage area, which is actually in the basement of this facility. So no room at all here to expand. And actually, this storage area flooded during a hurricane surge. So management saw this as an opportunity to completely rethink their approach to storage in this space. They called in their local storage team who analyzed the department's needs. Now, because this was an inpatient hospital, stored items would eventually end up in those patient rooms. So cleanliness was of utmost concern here. Now, in addition to saving space and improving efficiency, the new storage system would need to comply with a variety of health and safety regulations. So the storage consultant designed what you see here, a compact mobile system that saves space, provided staff with convenient access to these stored items, and then met all those health and safety requirements as well. They also sourced antibacterial coated wire shelving, and they had it mounted on those mobile carriages, as you see. This system is powered electronically and equipped with a high-tech safety system. Also, gapless rail and an aluminum floor discourage the growth of bacteria and other pathogens in this space. And finally, to wrap up this section, I want to highlight those break rooms and locker room areas. You want to think about these spaces where staff begin and end each day. Now, do they have a locker room that has high quality configurable lockers that offer storage for their uniforms, as well as their equipment and those personal items that they're bringing in and out each day? Now, a recent article from Steelcase discussed the top 6 healthcare facility design trends, mentioning that nurses and healthcare workers, they do, of course, run the risk of burnout. And it emphasized the importance of creating a culture that encourages rejuvenation and taking breaks when necessary. So having these areas that are well designed certainly helps with that staff satisfaction piece of the puzzle. Now I want to jump into some of the considerations to make when you may be planning these storage projects. Now I am going to hit on all of the planning considerations that you see here on this slide. And this is where I will really encourage you and do encourage you to lean on the support of your local storage teams. They truly are the experts in these areas. Can certainly help with guidance for any questions that you may have, but we'll go ahead and take a high-level peek into some of these considerations as we move through these slides. First, starting with ADA compliance. You should choose a shelving provider that assures that systems are designed to be ADA compliant. This includes aisles at least 32 inches minimum at a point and 36 inches continuous clearance for a wheelchair. Also for wheelchair turning, a clear floor space of 60 inches is needed, but ADA does set a maximum aisle length of 200 feet before a turnaround or passing space is required. Also, just want to point out for lockers, important to note here that 5% of the lockers in each locker room must be wheelchair accessible. So important to remember in design as well. Now, when using mobile systems in various projects, sometimes end users or architects hesitant to use mobile shelving in an adaptive reuse situation just due to floor loading concerns and the weight put on the structure. Now, reinforcing the floor, it is an option, but it can be expensive. So there are some other ways that these load requirements can be met. Just want to say, important to note and remember here that the load of a mobile system transfers as a line load at those rail locations. So the measurement to pay attention to here is 2 pounds per linear foot. Now, those other ways that load requirements can be met. First, the orientation of the system. Simply orientating the system's rails over those load-bearing points can help meet those structural requirements. Also, rail layouts. They can help meet these structural requirements as well. Every set of 2 rails, they must be the same distance apart, but there can be multiple widths in a single installation. Systems can also be relocated. They can be relocated to take better advantage of structural supports that may exist elsewhere. And finally, you'll want to lean on your local storage expert to determine how much deflection you can expect within the floor system. Certainly something that they can help in determining. And looking at the safety piece when using and installing a mobile system, Now, as you think about mobile shelving and carriages that run in tracks in the floor, questions about safety will come up. First, to initiate carriage movement, there are two main modes of operation that are available: mechanically assisted, which is a hand crank, and then also powered systems. Now, mechanical systems have a manual lock that a user can engage to prevent any unexpected movement. So that is the safety feature there. And then powered systems, they can be configured with many different safety options. And really, for this reason, it is best practice to install these systems in areas of high traffic or those of public access. Now, looking further at some of those safety features, powered systems can come with a photo sweep. This is when an infrared invisible red light beam is projected the length of the carriage at its base, and it stops system movement if it is disrupted by a person's foot or other object. So it will stop that system from moving. There's an aisle entry sensor available. If someone enters a closing aisle space, it will stop that system from moving. And then there is also a zero force entry. Now, to explain this safety feature, if 3 people enter an aisle space and only 2 people exit that aisle, that system will not move until that third person is outside that aisle space. It understands that someone is still working within the stack. And want to get into some additional features and benefits of powered mobile systems, starting first with fire protection. Powered mobile units can be integrated into the building's alarm system. They can automatically open carriages to allow water flow to reach them from sprinkler units, or compact down to prevent that water damage. Now, although ideally all damage would be avoided, damage from fire much harder to recover from than water damage. Now, some other features of powered systems include the ability to program systems to be parked closed at night. This helps save on energy and offers an extra layer of security. You can also program systems to be parked open at night. This helps with airflow. And then also there's an option to park systems to auto cycle at night. This helps promote that continuous airflow if you are storing some more specialized items. Now, knowing sustainability, such a significant part of the conversation in really all types of buildings, so important to understand how storage participates in that effort. Now, first, high density storage creates more capacity in a smaller footprint, alleviating some of the burden placed on interior space allocations. Now, alternatively, the use of mobilized storage can reduce the size of the building footprint, resulting in savings on construction, material, and overall operational costs. Now, as for materials, you're going to want to look for recyclable steel with post-consumer recycled content. Most steel contains between 50 and 90% recycled material, and then is also highly recyclable at the end of the project's life cycle. And steel will also maintain its integrity if systems need to be repurposed or reallocated down the road. And this might seem like a small detail that I'm bringing up here, but I do mention it because the savings really do add up. I'm going to want to look for a high density storage provider who can integrate systems with lighting fixtures so that the lights only illuminate when someone opens or is working in that specific aisle. And finally, going to want to seek out a storage provider who can truly support your vision with local consultants who can meet with you and your clients on site or online, and who can really dig into these details to determine your end user's needs. Your storage provider should be able to provide detailed space assessments of existing facilities to assist in making the best possible choices for the clients that you are working with. to wrap up here, here is a look again at those learning objectives that we've crossed off as we've went along here. Hope you're really walking away with some ideas of how thoughtfully designed storage can help these healthcare environments certainly achieve their goals. So at this time, I would love to open up the floor for any questions that you may have jotted down as I have moved through the slides here. Would certainly appreciate the opportunity to help answer those for you, and feel free to put them in the chat as well. Can certainly help answer those as well.
I don't have any questions yet, Megan, but thanks for going through that, all very thorough, and hopefully everyone's digesting right now and thinking of all sorts of wonderful questions to ask.
Yes. And I know it was a lot of information to throw at you early in the day here. So just again want to say that Space Saver, they can offer. We do have those local teams. Our local teams can truly be a resource. I'm sure I've said that term many times here, but it is true. Our local teams can offer site assessments, so they can come out to your facility, take a look at the space, go over a couple different storage options that would work for you. Those space analysis, they can help with drawing, with planning, and also complimentary, no obligation budget. So just some of that is available through our ACs. I do see some questions coming in here. Those slides from the presentation will be sent out as handouts there, so can use those to reference in the future. And when should the storage consultant begin involvement in the project? That is a very good question, David, and our response is as early as possible. We want to make sure that the storage is getting planned appropriately, that there's enough space for it, that these clients and you guys are truly getting what you need from your storage. So bring them in as soon as possible, especially in those adaptive reuse situations, so they can take a look at that floor, make sure that they are using the correct rails and things like that. So as soon as you know there's going to be storage involved in a project, I would go ahead and get your local team involved. They truly can partner with you, be a resource for you, and take some of the work off your plate and help with that along the way. So great questions there.
I see there's another question about common installation issues or challenges to be aware of when installing these types of systems. Oh gosh, honestly, that's such a general question. It might be helpful to take that offline and see how we can potentially provide a bit more details to review. I'm just thinking about from a floor loading standpoint, I would say that a lot of questions and challenges may come up from that angle. Again, whether it's depending, especially if it's an adaptive reuse situation, I would say that's where we get a lot of questions. So what we can do, Rob, is follow up with some information for you on floor loading in general, and that might be helpful. So we will take that as an action item and send you some information to digest there.
Certainly. And we have a question from Victor asking how HVAC is affected by those storage systems. HVAC definitely plays a role in our locker installs. So those lockers can be hooked up to that HVAC system. That way, the airflow, better circulation, some of those locker room smells can not happen with that hooking up that HVAC system to those locker units. So that's one way that we work in that HVAC space. And certainly our local teams can work hand in hand with any HVAC professionals that you're working with to make sure that everything is in compliance and ready to go for that area.
Yeah, and that's a good one too, just in terms of what is being installed, whether it's a locker system or if it's a high density mobile system. And again, that's where we would lean on some of that local code compliance to make sure that the vents are considered, of course, to determine how high you can go within that particular building. So again, I think potentially sharing some information with you, Victor, on high density systems that may answer some of those questions more specifically, so we can take that as an action item as well.
And Carrie has asked, what specific lead credits can this product contribute to? Laura, do you know specifically? I can provide some examples of projects that have got those lead credits, but if you could take that one as well.
Yep, materials and resource is going to be likely the number one, simply because these systems, whether we're talking high density or we're talking lockers, they are made with Space Saver specifically made with 89% post-consumer recycled content. So again, you're at the very high end of the spectrum from a recycled content standpoint. And then, like Megan suggested in the session, that these types of systems, their longevity is just about unparalleled. So if a hospital installs a high density system on the 4th floor and 5 years later, they determine that that 4th floor needs to be utilized for some other function, that system can be relocated and it will maintain its integrity for those relocations. We have plenty of examples of systems that have been relocated. We have plenty of examples of systems that stand the test of time. I mean, there are systems that have been in operation for 40 plus years. And so that type of element, it really you want to consider that as well. But I think too, I'm just trying to think of some other, this is where you'd get into some of those nuances of specific projects that Megan has referred to, depending on what a project, what that outcome is, or what the goal is of a particular installation. The systems can contribute to those LEED certifications some other ways. There's innovation and design. There's lots of projects that have helped with those LEED certifications. I think reducing the overall building footprint. Again, I'm thinking of some particular projects. So certainly, Carrie, we'd be happy to share some information with you that can help with that evaluation as you consider for your projects.
Awesome, thank you. And then we got a question about planning and square footage and what is needed and what types of storage is needed. And yes, you're correct. The storage consultant will be able to, if you have a plan that you're working with, or if they can go in and physically see the space, they're certainly able to go in, provide some insights. A couple different options for what will work best. Take a look at that floor, go over what rails will work best. So they can really partner with you in every step along the way, and take a look at that square footage amount, and let you know what the recommendation would be. And also, looking at things like price as well. So that is certainly something that those local teams can help with, and would appreciate the opportunity to partner with you on.
And then the last question is regarding CBD, cannabis growing storage. if they're going to be incorporated into traditional healthcare facilities? Yeah, that's a really interesting question. I would say it depends on the state. It depends on the level of legalization. It depends on the healthcare organization. I can't say I've memorized all of that, but we certainly do have those types of systems, grow systems that are available to help increase the canopy available to all of those plants. So certainly can follow up with you, Matt, on what those might look like, and maybe where the crossroads are between cannabis growing and healthcare.
Thank you so much for the questions, guys. I truly appreciate it. Appreciate your participation and engagement. Our Laura and myself's contact information is here, and then we will be getting everyone attendance reported to those AIA or IDCEC organizations, and then also sending a certificate your way. In those follow-up action items, we'll be sending some additional collateral your way as well. But again, feel free to contact us and ask any questions. We'll get you connected to the right people.
Okay. Thank you, Laura. Thank you, Megan. Thank you, everyone, for your participation today. Hope you enjoy the rest of your day.
Thanks, everyone.
Thanks, guys. Take care.